There's a shortage in this country. Hospitals need more nurses.
So UnityPoint Hospitals in Dubuque, Cedar Rapids, and Waterloo are hosting job fairs this week. A significant number of the nursing workforce is nearing retirement age in the next decade. UnityPoint is looking to get ahead of that coming demand by hiring staff now. Hospital officials say the hope is that the new nurses can learn from the seasoned nurses.
TV 9's Forrest Saunders is live at St. Luke's in Cedar Rapids this morning. Forrest, are they seeing the same challenges with nursing staff there?
Absolutely they are, and that's one of the reasons why we're having this job fair tomorrow in Cedar Rapids. Carmen Kleinsmith joins me now, and tell me a little bit about the nursing shortage locally. What are you seeing?
Well, there's a lot of things that have gone into that nursing shortage, and for one thing, it's really an exciting time for nursing because there's all kinds of opportunities, not just in the hospital, but in our clinics, in our post-acute areas, in our outpatient areas. And so to fill all those positions, we're asking folks to come in and take a look and see what we have to offer. We also have the baby boomers that'll be retiring soon, and so we want to fill those positions as well.
And that's an issue just about anywhere you go, is that you have a retiring workforce. So you guys are trying to get out in front of it, I take it?
We are, and we know that as healthcare changes, we're going to need more and more roles. When I got out of nursing school, the hospital was the place to be. It was the center of the universe, but now there's so many other places that nurses can work that we want to get a good start on filling those positions.
Are you concerned because you have such a large number of people that will be retiring that you might have a bunch of new people without any experience?
Well, one of the things we want to do is try to get those positions filled while we still have all of our trained and tenured staff here. It's really nice to get a good mix of tenure, those in the middle of their career, and those that are starting, and it creates a good culture that way.
And you're looking forward to all of that happening here in the coming job fair tomorrow, and I think that you guys have two more. There's going to be one in Waterloo. That's going to be on Thursday. You also have one in Dubuque, and that is today. And then, of course, Cedar Rapids, which is tomorrow. All of those start at 3 and run until 7 o'clock. Ashley, Nicole?
TV 9's Forrest Saunders, thanks so much.
There is a shortage of nurses in the U.S.
The national demand for RNs has UnityPoint Health Hospitals in Cedar Rapids, Dubuque, and Waterloo hosting job fairs this week. Much of the nursing workforce is nearing retirement age in the next decade. UnityPoint is looking to get ahead of the coming demand by hiring staff now. Hospital officials say the hope is that the new nurses can learn from the seasoned pros.
TV 9's Forrest Saunders joins us live from UnityPoint Health, St. Luke's Hospital in Cedar Rapids this morning. And Forrest, this job fair covers more than just those open nursing positions.
It does. It's more than just RNs. You have a whole bunch of different positions that are open here at the Cedar Rapids UnityPoint St. Luke's Hospital. But specifically, let's focus a little bit on nursing because that's the greatest demand, and that's one of the biggest reasons for having these job fairs. Carmen Kleinsmith joins me now. And tell me a little bit about this demand for nurses. Why is it happening?
Well, there's a lot of reasons for why it's happening. Not only do we have the hospital positions that we want to keep filling, but we also have lots of positions out in our post-acute areas, home care, our clinics. We have more physicians coming into town. We have more needs for staff to help coordinate care, to help get patients, navigate them through our system.
And you have a retiring workforce, and we talked a little bit in our last half hour about it. Experience is very important, and that's why you're trying to do overlap with new and existing employees.
Yeah, it's great. We need to tap into the experience that our tenured staff brings us. They have a lot of information, they have a lot of talent, they have a lot of expertise, and so bringing new staff in to work with that staff before they get ready to retire is very, very important to build, our consistent, safe staffing patterns.
I think I heard that you guys have about 80 positions that are open here in Cedar Rapids. Majority of those are nursing. What are you looking for when people show up to the job fair?
Well, what we're looking for are people that really want to work in a culture that supports our staff. We have lots of continuing education programs. We have lots of teamwork. We have some great managers that will be available tonight at the hiring fair, and looking for that culture, that fit, because as a magnet organization, we're looking for those talented folks that really want to make a difference in our patients' outcomes.
Carmen, thank you so much. And just to recap real quick, the job fair here in Cedar Rapids, that's tomorrow, and it starts at 3 o'clock, goes till 7. The job fair in Dubuque, that's today, and that starts at 3, goes till 7. And the job fair in Waterloo, that's Thursday, and that starts at 3, goes till 7. Ashley, Nicole, back to you.